day-to-day basis, but that doesn't mean breathing down your neck. Doctors therefore need to be supported as leaders and managers to do that well, because this is where the tension has been, at least in the NHS. And I also made a recommendation about regulation, distinguishing the roles to reinforce the complementarity. Complementarity, not confusion. And then career development. And this was the area that PAs really wanted, because when they were introduced in the UK, it really wasn't clear about how the role might develop. So I've recommended a number of things: 2 years secondary care experience before undertaking work elsewhere in the system, to make sure you build that confidence and competence. That we have career development opportunities, and I've recommended training modules so that PAs can progress in a flexible way. And I feel quite strongly that flexibility for PAs is important. We have now got the training of doctors, or what I might describe as a sort of production line, and it's very inflexible. And I think it will be much better if PAs can have flexibility and can do accredited modules, and then you'll be able to say, I'm now able to do this area of work because I've been through the training, and with the potential to become an advanced PA and to prescribe with the appropriate training. I didn't buy the argument that PAs should never prescribe, because other healthcare professionals can with appropriate training. But we do need to make this work. We need good links with the medical royal colleges, and we need to re-establish a faculty for physician associates to help set those standards. And I did make it clear in the review that it might not be a straightforward transition, and we need to make sure PAs are supported during this phase. Change is never easy. And some of this change, some of the change we've already seen, needs good local management to make it work well. So there's a little figure in the review that talks about PA career development. It talks about being a newly qualified PA, 2 years post-qualification, and then ongoing training, specific credentialing, allowing flexibility, allowing development, and then becoming an advanced PA that I recommended was one band higher. We have this banding system in our NHS. So, very, very clearly set out in the review, and I think an important way forwards. Now, there's another different story about PAs who are already working in the system, who might have a lot of experience, and absolutely not expecting them to go back to the beginning, and that they, their roles should be reviewed at a local level and presumably, able to carry on. That's not my decision, but this is about what happens if you start now. So I hope I provided some clarity. I hope I recommended things that provide clarity for patients, clarity for PAs around career development, faculties, standards, security for the future is my intention. And for doctors, because doctors have to get this too. We have to work together. It won't work otherwise. And for the wider system in terms of job descriptions, role identification, etc. I had a very tight timeline to do this review. I'm not expecting much sympathy, but it was a very tight timeline. So there is more to do. We need to now pick up these recommendations and provide some further clarity. We need to collaborate. We need to work out how the roles are working in practice at the local level. I have suggested that we have a national working group with the relevant professions around the table, including PAs, to make sure we draw on the best practice examples, and there are some, and we describe that, and we make sure it rolls out everywhere. And that includes having an effective team structures for doctors, the wider healthcare workforce, because that's clearly not working now. Part of the problem was, that the support in some places was better for PAs than for the doctors in training, and we need to make it work for everyone. We need to determine workforce requirements, as I've already mentioned, and we do need to improve safety reporting. As I went through this review, I mentioned the data was poor. I really hope nobody else ever has to do a review like this again. I'm not sure it was the best thing to ever do, but we should have some safety measures. We should be able to draw upon data nationally to tell us whether there's a problem with a particular group of staff, if we need to. So just final slide. I don't see this as the end of the story, it's the beginning. And we do need to have a roadmap to develop the roles further so that they're clear and well embedded at a local level into multidisciplinary teams. In particular, we need to learn lessons from how the role has been implemented at a local level. This is nothing about training, it's about how the roles have been used at a local level, so that we build effective multidisciplinary teams that improve patient care and that work for PAs. So PAs have clarity of role and that it is more effective and running well, because there's so much work to do in our health system. I'm sure every health system in the world is under pressure and we need people to work together in effective teams. So that's what I'd like to see on the back of this. I better stop.